I am a 26-year-old female surgeon. Yesterday, a patient refused treatment because he thought I was the candy striper. The $300,000 medical degree hanging on my office wall apparently isn't enough to convince some people I am actually a doctor. Neither is the white coat with Dr. Chen cardiothoracic surgery, or the stethoscope, or the fact that I am literally standing in an operating room reviewing their cardiac scans. Yesterday took the cake though. I walked into pre-op to meet Mr. Davidson, a 58-year-old scheduled for a triple bypass. I'd spent hours reviewing his case and planning the procedure. As I approached his bed, chart in hand, he looked right past me and continued his conversation with the male medical student who was shadowing me that day. When's the surgeon coming in? Mr. Davidson asked him. The student, to his credit, looked uncomfortable. This is Dr. Chen. She'll be performing your surgery today. Mr. Davidson laughed. Eckley laughed. No honey, I mean the real doctor, the surgeon. I've developed a thick skin after 4 years of this, so I smiled professionally and extended my hand. Mr. Davidson, I am Dr. Chen. I'll be leading your surgical team today. I've reviewed your angiogram. And he cut me off, looking at my student again. Is this some kind of joke? I am not letting some girl who looks like she should be handing out juice boxes operate on my heart. The room went silent. My student froze. The nurse checking the iron stopped what she was doing. Mr. Davidson, I said calmly, I graduated top of my class at Johns Hopkins. I completed my residency at Mayo Clinic and a fellowship at Cleveland Kettering. I have performed over 400 cardiac procedures with outcomes in the top 2% nationally. I understand you are nervous, but I assure you, you are in excellent hands. He looked me up and down. How old are you? 22. I want a real surgeon, a grown-up. I am 26, and I am a real surgeon. Well, I want someone else. With experience, affably a man. I could have called my department chair a 62-year-old male who would have told Mr. Davidson exactly the same things I just had. I could have stepped aside and let another surgeon take the case. Both would have been easier than what I did next. Mr. Davidson, I said, pulling up a chair. I understand this is scary. Having your chest opened up is terrifying, and you want to feel confident in the person holding the scalpel, but I need to be clear. There is no one in this hospital more qualified to perform this specific procedure than me. I pulled out my phone and showed him my surgical outcomes dashboard. Bart, the data we're required to track. These numbers mean I have the lowest complication rate and shortest recovery times for this procedure in the entire hospital system. He stared at the screen, then at me. You have 3 options, I continued. You can proceed with me as your surgeon as planned. You can request another surgeon, which will delay your procedure by at least 2 weeks given current schedules. Or you can transfer to another hospital, which would mean starting the intake process over, given the blockages we saw on your angiogram. I wouldn't recommend waiting, but it's your choice. The room remained silent for what felt like forever. Finally, he sighed. Fine, but I want to meet the whole team before I go under. 4 hours later, I successfully completed his bypass this morning during grounds. He was awake, stable, and noticeably quieter than yesterday. As I checked his incision, he finally spoke. I owe you an apology, Dr. Chen. My wife set me straight after you left yesterday, said I was being an idiot. He paused. She was right. I nodded. Apology accepted. How's your pain level this morning? As I left his room, a young girl in the hallway, paired her, maybe 10 years old, parent stopped me. Are you really a hard doctor? She asked, eyes wide. I really am. I want to be one too sometimes. That makes all the other moments worth it. If you've been underestimated because of how you look, share this video and comment qualified.